You're watching Cable 2.
4. You're up.
Welcome, everybody. My name is Dr. Corliss Thompson-Drew, and I am Director of Psychological Services for the Winston-Salem Forsyth County Schools. The district has collaborated with community partners and agencies to bring you this forum in response to some recent events and what we know to be some emotional and behavioral health concerns due to those recent events. The format for our program this afternoon is a panel. We have a list of panelists here whom I will introduce in a moment. They will respond to questions posed by our moderator. For those of you that are listening in and are in the audience, please place your questions in the chat. At the end of the panel presentation, we will have some time reserved to respond to those questions. Our panelists are as follows. We have Sonia Long-Williams. Sonia is a licensed clinical social worker here in the district, and she's also a licensed clinical addiction specialist. Her work with the district includes serving as a court liaison, serving on the district crisis team, working with the School Justice Partnership, and serving as a member of the Juvenile Crime Prevention Council. Alexia Mitchell is a therapist with the Alexander Youth Network. Dr. Linda Nicolotti is our moderator. She's an assistant professor in the Department of Pediatrics and section head of Pediatric Psychology and Behavioral Health at Atrium Health Wake Forest Baptist. She's a pediatric psychologist with specialization in working with children, adolescents, young adults, caregivers, and families. Before we proceed with our panel, we have our interpreter, Anayeli Moreno Vasquez, to share some information.
Buenos días, buenas tardes a todos. Aquellos que necesitan la traducción, la interpretación de esta reunión, favor de marcar el número 336-703-6797. Después pedirá un número de conferencia que es el 2016 y un número de PIN 458796. Esta información está en el chat. Llamen a ese número y yo estaré haciendo una interpretación simultánea de la reunión para no interrumpir la reunión. Así que si necesita una interpretación en español de la reunión, por favor haga esos pasos, están en el chat y yo estaré interpretando. Muchas gracias. All right, thank you very much, Ms. Thompson.
Now I'll turn the program over to Dr. Nicolotti.
Okay, hello everybody, and thank you for being with us. I would just want to start off with a few comments. We've recently been faced with an increased presence of guns and gun violence in our local schools. Very tragically, William Chavez Reynard Miller Jr. lost his life on September 1st as the result of a school shooting at Mount Tabor High School. As a community, we mourn this tragic loss. Our deepest sympathy goes out to the family and friends of William Chavez Reynard Miller Jr. We hope that the information provided today will assist parents and caregivers in assisting their teens with coping related to the school shooting and concerns about safety at school. So we're going to start off with a number of questions that many parents and caregivers may have, which will be answered by our panel of experts. The first question is going to be for Sonia Long-Williams. How do I talk to my teen about the school shooting and safety at school?
Well, good afternoon, everyone. Thanks for having me. I think one of the biggest things that as parents we need to recognize is that we have to open up the line of communications with our students. It's okay to ask what their thoughts and feelings are about what they've heard about the shooting, things that are going on currently at school. Talk to them about what's currently happening on social media. And if they have social media, if you have access to be able to monitor that, first and foremost, be a good listener. A lot of times we get more information from our students if we allow them to talk and not interrupt. Validate their feelings, even though they may not feel the same way that we do, their feelings are still valid. And finally, provide assurance that the school personnel, the police, and their staff at their school are working to keep them safe every day, and try to make sure that this type of tragedy does not happen again.
Thank you, Sonia. That's really helpful information. So I'm hearing what you're saying is some important things are listening to your teen, providing opportunities to open up communication and talk, and very importantly, validate their feelings. Okay, thank you. We'll move on to the next question. And before I pose that question, do we have Brittany Todd on?
Yes, I'm here.
Okay, great, Brittany.
Yeah.
So your question is, if I ask my teen how they're doing and they say, I'm fine, but you don't think they're fine, what should you do?
So first, I would validate that that's pretty much the normal answer. We have that knee-jerk reaction of, hey, how are you? I'm fine. So kind of expecting that, I think we live in still the buck-up society. So one, not necessarily reacting to the I'm fine, and then just immediately generating a conversation. And again, as we just said, validating their feelings, knowing that you don't have to understand, that's not the goal. The goal is to open up a conversation and create a safe space. I also, as a mother myself, am not above to kind of diving in a little bit deeper and I appreciate that you're fine, but let's just talk about it anyway. Encouraging them to reach out to their friends, encouraging them to talk to a school counselor, to a mental health professional, and offering to go with them, offering, hey, why don't you just go talk to somebody other than me, because I realize that I'm your parent, and that's not always the cool thing to do. Humanize yourself. I try to be fine sometimes too, but I'm not, and that's all. That I got to really bring that to the table, and I'm a human being, and so this has affected me. I'm also, as a mother, not above forced family time. Once we get started in that, we usually all have fun, and it's a great experience. And we may dread it, but it ends up being a positive time for everyone. Ultimately, studies have shown that 9 minutes a day of face-to-face quality time with your child can cultivate a deeper relationship and create that safe space that we're trying to talk about. So definitely every day trying to make that 10-minute connection with your kid, because I know that especially with our teens, sometimes it feels like we're ships passing in the night.
Thank you, Brittany. That was very helpful information. So I'm hearing you about the 10 minutes a day. So the making opportunities for communication and connection seems like that's one of the really important things. And just keeping in mind that even 10 minutes a day, you don't have to necessarily set aside a whole hour of your time to be together. I know families can be really busy, but finding that 10 minutes can be really important in helping with your connection and helping your teens cope with what they're dealing with.
Yes, quality over quantity, right?
Yeah, thank you. So helpful.
Yeah.
Okay, our next question is for Alexia Mitchell. What are some ways parents can help their child cope?
Good afternoon. Some ways that parents can help their children cope is having a structure and maintaining the routine that you already had. That way things can be made more predictable. Also, such as Brittany said, spending time together as a family is very, very helpful. Also, trying to limit the exposure to disturbing social media and news media, but also using relaxation techniques such as belly breathing, mindfulness, and meditation. I always tell my children to smell the roses and blow out the candles. That way, that can help them to visualize some of the images. Because if you tell them just take a deep breath, sometimes they can't visualize. So smelling the roses and blowing out the candles will help them with that belly breathing. Also, focus on the gratefulness around us or around them, allowing them to be grateful for them. Being around their friends and being around their family can also help them to cope. And lastly, talk to your teen about what they can do if they hear or see something concerning about another student, such as if another student is making a threat or if they have heard someone else carrying a weapon. All of these things can help them to cope and feel safe during this time. Thank you.
A lot of really good tips and strategies there. Again, I'm hearing this theme of connectedness, togetherness, modeling for your child or teen, creating opportunities to teach them strategies or use strategies with them. So a lot of great things about cultivating gratefulness, implementing that structure routine, being together, limiting social media, which can sometimes be a positive, but also sometimes be a negative.
Yes, absolutely.
And I like your suggestion about smelling the roses and blowing out the candles. It can be helpful to have that visual.
Absolutely. Absolutely.
All right, thank you so much. So our next question is for Dr. Laura Veach. What are the signs of acute stress disorder and PTSD?
Thank you. I'm honored to be here and hope this can be helpful information. Acute stress disorder is a diagnosis that requires certain symptoms in order to meet that. It goes beyond anxiety, or it goes beyond, I'm upset after an event such as we've had. And it is really involving symptoms that persist, especially within the first several days through 1 month following a traumatic event. Has very similar kinds of features and symptoms like post-traumatic stress disorder, which is also more prolonged stress reaction that is often called PTSD. Some symptoms that you may see in a young person would be some of the startle reflexes, complaining about, I just can't get this thought out of my mind, I can't stop seeing these images, I'm having flashbacks, very distressed about what I recall very vividly, sounds, smells, reactions, and it's sometimes playing that over. It would also involve some really distress, negative emotions, hypervigilance at times, really, being more watchful than usual, and asking questions, did you hear that? Hearing noises, anything that is reminiscent that may trigger a recall of the event is part of what can happen. It really would involve seeing a helping professional who would be able to make that diagnosis. It wouldn't be something that a parent or caregiver would want to do at home, but it would be something to help. Some people do have a prolonged response and may be diagnosed with acute stress or post-traumatic stress, and there is help, and there's a lot of different options, thank goodness, these days, that may or may not require medication, but can be very brief in nature, so that's part of what we look at with acute stress or post-traumatic stress.
Thank you, Dr. Veach. So that's helpful, I'm sure, to parents and caregivers about what symptoms they can be looking for and what signs might be concerning. And also comforting to know that there is a lot of help out there if your teen is experiencing something like this. And just a follow-up question to that, the teens from Mount Tabor were most directly impacted by the shooting. But I think teens at a lot of neighboring schools experienced a lot of stress as well. So, could teens that are from other schools where this event did not happen, could they be at risk for acute stress or post-traumatic stress disorder?
Great question, Dr. Nicolati. And from what we see in working with individuals who've been through really adverse events or have through social media been exposed, or news, or parents that are upset, that any of those kinds of very strong emotional events that involve strong emotions could trigger one's own reaction. Often we see sometimes a bystander may have more difficulty working through some of the traumatic recall than a person who was actually, in the traumatic accident. I work in the trauma center, physical injuries. So it is important to definitely, I agree, look for students who may be in schools in other settings. It doesn't have to be high school. It could be middle school. Any young person who's aware, who really is having difficulty sleeping, having nightmares, having startle reflexes, much more hypervigilant. Those are the individuals that I would want to reach out to and begin to learn a little bit more of what's going on, and is this a pattern, and let's go see who we might talk with about this, starting with a school counselor, perhaps.
Mm-hmm. Thank you, Dr. Beach. That's very helpful information. So, and our next question is, again, for Alexia Mitchell. What risk factors or warning signs do I look for regarding my teen's adjustment or possible signs of depression or anxiety?
So yes, sleep difficulty or excessive sleep. If you're noticing some changes in their appetite, withdrawn behavior, that is also a common warning sign. Refusing to go to school. Having such a traumatic event to take place in your school can have you to refuse to go in fear of something like that happening again. Trouble concentrating, their grades declining, also some personality changes. And also a change from prior functioning. So if you're seeing that your teen was involved in doing things prior to this, but you've seen some decline in some of their functioning from day to day, that can also be a warning sign. And also just difficulty enjoying or having fun, enjoying the activities that they once enjoyed, and now they're no longer enjoying those activities or having fun. All of these are warning signs or risk factors that you should look for with your teen. Thank you.
Yeah, thank you, Alexia. So there really are a lot of symptoms and signs that parents and caregivers should be aware of, even in addition to the acute stress or PTSD type symptoms. There's a lot of symptoms that could be reflective of anxiety or depression or just an adjustment type of response. And your point about, a change from prior functioning is also a good one. So be looking for changes that your teen or child may be experiencing or that you might be observing. And also just, I think, an extended time frame too. If you see something lasting more than a few weeks, that might be more of a concern.
Absolutely.
Thank you. Okay, so our next question is going to be, again, for Dr. Laura Veach. How do I know if my teen needs professional counseling?
Great question, and very much along the lines of Alexia's response. When the young person is having more difficulty coping and showing signs and symptoms, that is certainly an indication for professional counseling. And I will also say, Hollywood probably hasn't done us any favor, and I'm not sure about social media, because anytime someone wants to process or make new discoveries about oneself or grow and adapt, anytime your young person says, I really want to talk to somebody about making changes or exploring life or making different decisions, time management, any of that is a great opportunity for professional counseling. But around some of the events here, when there's struggle and distress that's sustained, that doesn't go away on its own, and you're concerned, your somehow intuition is telling you, something's really not right here. This is continuing and I'm really concerned. Great, go with your child. You can go together, you can make the appointment. All of those things help. Thank you.
Thank you. That's really helpful information, Dr. Veach. So, looking for these more serious signs and symptoms and red flags would be an indicator, it sounds like, that professional counseling would be helpful. But also just any interest that your teen or child might express in wanting to talk to someone, wanting to work on, really any issue, however minor it is. Thank you. Okay, our next question is for Brittany Todd. I'm having a hard time coping. How do I deal with my feelings in all of this? So this is from the perspective of a parent or caregiver.
Yeah, thank you. So this is such a common question that we actually get at our practice because parents don't want to put their emotions on their children. However, I think that happens all too often without parents even realizing that they are almost victimizing themselves in an effort to even connect with their child. So all the things that we can Google are going to be self-care, exercise, deep breathing, reaching out for help, and those are awesome. I think something that we forget that is often offered too are parent support groups. And since COVID has taken place, there are a lot of online parent support groups as well that even have special apps that you can just hop on, even if you're in the carpool line or if you go out to coffee. Sometimes you don't even have to participate, but just hearing other parent stories can help you feel like you're not, can make you realize that you're not alone, because so many parents have gone through this and are continuing to experience difficulty, especially during the pandemic. And again, like just the kind of the theme that we've all been saying is talk to your family, talk to your kids, humanize yourself, like I'm also having a hard time. My favorite question is how can we support each other? How can I support you? And communicating our needs as parents to our kids encourages them to communicate their needs to us, because we are not invincible as parents, nor should we ever be expected to be. That's too much pressure. So I think just really making it, coming forward and saying, I'm having trouble, let's do this as a team, and then seeking your support and leading by example. So important. As parents, we see self-care and even seeking help sometimes is selfish. We're supposed to be constantly pouring into our kids, and we forget that they watch our actions. And if we're taking care of ourselves, if we're going to therapy, if we're doing support groups, if we're exercising and spending time with our friends, that encourages them to do the same. So it's not selfish, I promise. And the other thing I did want to kind of piggyback quickly on what Alexia said that we've been seeing in our practice are, in terms of changes in behavior, are these teenagers that are all of a sudden taking on everything and making themselves super busy and overscheduled in an effort to avoid this fear and anxiety that they're feeling. And this is kind of masking things and making it look like they are okay, when in reality they're just trying to keep themselves 100 until they go to 0. So just, a change in behavior, I think, as parents, we don't always pay attention to, and that also goes for ourselves.
A lot of really helpful tips there, Brittany. Thank you.
Thank you.
Yeah, so it sounds like, from what parents are looking for in their kids, sometimes even positive behaviors, there can be too much of a good thing, where if teens or kids are getting over involved or being over responsible and maybe stressing themselves out because of that, that could even be a warning sign. And parents can do a lot. There's a lot out there for parents. It sounds like, they can access things online or via apps, or there are in-person opportunities, and parents and caregivers can be good role models for their children and teens. They can invite their children and teens to do things together. So it sounds like that modeling can be a really appropriate thing. And it's like they say about the airlines. I don't know if we are all flying quite as much as maybe in the past these days, but they always say, you know, fasten your own oxygen mask before your child's, which might seem a little mean, but we do have to take care of ourselves in order to be able to take care of our kids. It's really important. And it's not selfish. Yeah, the airlines agree with us. So thank you, that's all very helpful information. So our next question is for Sonia Long-Williams. What resources are available at school to assist my teen with coping?
So the resources may vary from school to school. However, all schools do employ school counselors and social workers. Some schools may have a parent or family engagement person that they utilize as well. Some schools partner with the School Health Alliance, so they have a therapist, a nurse practitioner on site. There are schools who are in partnership with other agencies, like maybe family services, youth villages. They have different MOUs, which is memorandum of understanding, and so they partner with other mental health agencies in the county. If parents want a list of those resources, they should be able to access that through their student services center, which again includes your counselors, your social work staff, and parent family engagement. You may have some graduation coaches, lots of different resources. But one of the things that I do want to point out is that we were talking about resources at school. One of the things I like to, when I'm working with the student, is to ask them, you know, is there at least one adult in the building that you feel safe talking to? And if they can't identify that person, then we kind of go through and talk about who that person can be. It can be a coach. It can be somebody in the front office. It can be a cafeteria worker. So it doesn't necessarily have to be the traditional people that you think it would be, but somebody that they feel safe talking to and sharing things with, so that they feel comfortable at school.
Thank you, Sonia. I really like that last question you brought up, is helping them think through who is that one person you can talk to and identifying that person. That seems like it would be really helpful for every student. And it also sounds like there are a lot of resources available. Parents and caregivers may not necessarily know about all the resources that are out there, but they can find them out from the school counselor and social worker.
Absolutely.
Okay, great. Thanks so much. And I think we have time to go over a few additional questions and answers before we open up to the chat. So this next question is for Brittany Todd. My teen is having a hard time sleeping. How can I help them? How do I know if they would benefit from medication for sleep?
Yeah, so this is a huge thing with anxiety. I think it's one of the number one things that, you know, we hear from teens as practitioners. Stress and gets so much worse at night. I don't know what that, it's just like this phenomenon that everything's okay when we're busy and then we hit nighttime and it all floods. So, you know, we can sit here all day and say like, well, journal and take deep breaths and stuff like that. I don't have any teenagers that are going to do that. They're going to laugh at me when I say that. But what they do respond to are things like, you know, make bullet points in the note section of your phone. And if it's something that you want to remember to revisit the next day, set reminders. You know, or maybe you have you see a mental health professional, or there is an adult at your school that you feel like you can confide in, and you want to make some notes of things to talk to them about, so we're not looping through these thoughts when we go to bed. I think that's a great way. Also, encouraging them to disconnect from their electronics. I mean, you know, there's the blue light situation, but there's also the social media situation. And it's easy to get caught in that. And I think you know, the TikTok situation, that is a whole thing in itself, and we could talk forever, but it's so easy to get addicted to just the scroll, like one more video, one more thing. If we're experiencing a lot of anxiety, there's a lot that you can go down a rabbit hole on Google. So really separating from those electronics, maybe going back to the good old days where we read actual paperback books can also help. Brain dumps in your notes section, like I said. I think if none of that's helping and we're really feeling like sleep is impacted, then definitely a conversation with their family doctor or pediatrician is warranted. There's a lot of holistic supplements that they can give and really have a deeper conversation on how they can support. Sleep is ridiculously important to mood management and stress management. I think a lot of times if we aren't getting enough sleep, we experience higher levels of anxiety and impulsivity, and then we can also go the other direction and feel very depressed and physically sick. So I think sleep is definitely something to prioritize and encourage in these conversations with your child of, hey, let's really make sure we're doing this to take care of both our physical and our mental health.
Yeah, thank you, Brittany. So I'm hearing you say that sleep is so important for health and well-being. So
Yeah.
regardless, I mean, it's not just about feeling tired the next day, but sleep has important implications for how we're feeling in general, mood-wise and health-wise. And there are a lot of strategies out there that can help teens with sleep. Screens, I think, are a big culprit, like you were saying, and trying to wrangle those screens out of their hands maybe before bed and helping them understand the importance of that can be really helpful as well.
Yeah.
Thank you. Okay, and our next question is for Dr. Laura Veach. What signs or symptoms do I look for related to my teen that might be, if I'm concerned they're using substances or abusing substances, which I know sometimes teens will resort to that if they're having difficulty coping in other ways?
Yeah, thank you. This is such an important question, and I've been working in this area of focus for 41 years, and it is not an easy one to answer. Because primarily for youth, you, the parent caregiver, are going to be the last one that they want to know that there might be some using going on. And at a youthful age, it's easy to think I'm invincible and I've got it all figured out and I know what I'm doing and I don't care what anybody else is saying. I know. So I will say staying connected. We talked about that earlier with our young, wonderful children and adolescents when they even aren't wonderful is a huge, important stressor. When we look at some of the literature, it shows, having dinner together on a frequent and or consistent basis and having conversation without the electronics, as Brittany pointed out, are a very important protective factor. And we can't be there 24/7, and we can't know who's using, who's not using. So it's important to try to stay connected and hear them. How much stress are they under? How are they coping with that? How much are they struggling with being popular enough, being beautiful enough, being cool enough, all of those things. So conversations, and I've said this earlier, some of my most profound conversations with my young person have been in the car. It wasn't a planned family meeting, table time, and I knew, oh, this is really important and profound. So parents also being connected and being ready to be present, being willing to be present, even when we're in a hurry, even when we're rushing. There are just so many important times to be there. So I would say you will not always know. Certainly there are traditional signs, grades dropping, different appearances, different friend groups, patterns have changed drastically. And I say that at the same time, I say that, sometimes being a teen brings about all of those same things. So that's why it's so challenging. Addiction experts and specialists can be consulted, just like if you were worried about your child's, I don't know, they have a strange spot on their hand, and should I take them to a dermatologist? Of course you would, a specialist. So it's fine to take your child, go with your child for a specialist appointment. Addiction specialists in the state of North Carolina are licensed for independent practice, and they're easy to find, and we have more and more addiction medicine physicians who specialize in that particular area. And I would also say parents and caregivers, what we find so often is the access to drugs and drinking is often through the home. So the more you're watching your own behavior, you're locking up, especially prescription opioid type drugs or any other mood altering drugs, is critical. And we don't see that enough, or take them to dispose of them at a particular approved drop box, and the police department and or pharmacist can tell you where those are if you may not know. Very important. We see many studies have shown that more you find pills in the parents' cabinets and take them out to parties and with others and don't even know what the effects are. So being mindful of that. Those are some of the key things, and talking with, not asking questions, not doing an interrogation, but having conversations about, friends that they may have that they may wonder or are concerned about their using or smoking or drinking. So those are some of the ways that the parent or caregiver can try to reach out and explore that. If, I will say this, the child is clearly intoxicated, clearly impaired, you smell smoke in their room from marijuana, or they're eating brownies that have a lot of high THC content and they are high. That is a clear sign that it is time to talk with someone who is a specialist, because again, you're going to be the last person that they want to know this. So it would be helpful to reach out at that. Thank you.
Thank you, Dr. Beach, for sharing all of your many years of expertise with us on this topic. I think it's a really important topic, and it sounds like from what you're saying is that most teens are going to try to hide this from parents. So not every teen is going to use or experiment with use, but some will, and most are going to try to hide it. And again, this message of creating opportunities for connection, just being with your teen. Sometimes your teen may choose to tell you something really important. Sometimes they may choose not to say very much, but creating those opportunities to spend time together, paying attention to what they're doing and who they're spending time with. Sounds like that's really important too. And just being aware, asking them, being present. Those can all be protective factors for teens. And then if you do have concerns, if you have noticed some use or abuse of substances, there are a lot of good specialists that you can seek out in the community. Thank you so much. Okay, so our next question is for Alexia Mitchell. How can I assist my teen who's grieving the loss of a friend?
So first, I would recognize that your teen may be experiencing a range of emotions during this time in response to the grief, including, they may be in shock, they may feel numb, there may be some guilt going there, and also understanding that there is no right or wrong way to grieve, and that there are individual differences in the way people grieve in the grieving process. Grief does not progress on a linear type of process, and it's a process that takes time. It's not something that occurs overnight. It's not something that occurs within a month. It may not show up today. It may not show up tomorrow, but the good thing is that you will create an environment or an opening for your teen to talk and to share their feelings with you, and to be a good listener, and ultimately to validate their feelings when they come to you with these range of emotions. Also, encourage your teen to take good care of themselves and connect with their friends and their loved ones. So definitely self-care would be a great thing to do and encourage for your team to engage in. And again, I will reiterate to encourage those consistent routines, not to veer off and do things that you wouldn't normally do per se, but to continue to keep those routine and those patterns that you have been engaged in prior to this traumatic event. And also encourage you to solicit the support of your pastor, your clergy member, or any type of religious entity that you may be involved in, to reach out to those community supports or networks that your children or your team may be familiar with. Thank you.
Thank you, Alexia. It's really helpful advice there. One thing I'm getting from what you're saying too about the grieving process, and unfortunately, I think a lot of our teens have experienced some loss of peers or friends, also just loss of family members that they may be grieving. And it is an important topic, I think, for parents and caregivers to be able to address with their children and teens. And it sounds like there's, grief is sometimes thought of as a linear process. There are these stages that people move through when they're grieving, but it's not necessarily a linear process, it sounds like. And everybody might have their own particular path in the grieving process. And so if a family is grieving the loss of someone known to the family, different people in the family may be handling that in different ways. And again, it sounds like this issue of connection and communication is coming up and very important.
Absolutely.
Thank you. And let's see, so one final question that we've touched on a little bit, but I wanted to see, it's for Sonia Long-Williams. I wanted to see if there's any additional information that you might want to provide about helping your teen feel safe at school.
So I think the first thing to address is that there are different ways that a student may feel unsafe. This particular instance, we initially started talking about the school shooting, but there may be bullying. There may be, as Dr. Leach talked about, feeling unsafe because other kids are using drugs maybe at school. So again, be willing to ask the question. I know some parents are not very comfortable in having those conversations, but you have to start with asking the question. And then if you feel like you're at a point where you can't go any further, that's when you reach out to, a professional at the school or in the community to kind of help you go forward. But if you are comfortable, talk to them about some things that they may see as warning signs. If you see one of your peers continuously talking about, guns or knives or violent type situations, make sure that they are comfortable in, again, seeking out that adult that can help them navigate through that. It's not being a snitch. They're not detectives. But if they see something that makes them feel uncomfortable, I think at the school level, they have to have that environment where they feel like they have people that they can go and talk to. It could be a coach again. It may be an assistant principal. It may be somebody that's in a club that you're involved with. But identify those people and, encourage them to talk to those people that they may have concerns. Again, I'll give a shout out to our counselors and our social work staff. Some of our schools have nurses on staff as well. They are kind of the front line of defense. And I think they do a great job at helping our kids navigate these situations. So just encourage them to reach out and express what it is that they need. Because sometimes we want to kind of figure it out for them, but a lot of times if you ask them, they'll tell you what it is that they need. So I think that that's important to be willing to listen to them.
Thank you, Sonia. Yeah, our youth are smart and resourceful, and sometimes a lot of times they have really great ideas. They might just not know how to implement them sometimes. And your other message is coming across again as having, at least one person that you can talk to. If you're not feeling safe, talk to someone about it. Who can you talk to? Identify that person. There are resources out there to help them. Thank you so much. Okay, so I think this concludes our more structured part of the question and answer session. I really want to thank our wonderful expert panel for being here today and answering these questions. There should be some opportunity for putting questions in the chat, and I believe there are some questions in the chat that our panelists can address at this time, and Dr. Thompson-Drew will take over and pose those questions.
Okay, so yeah, there are just a couple questions, and I think Jonathan is on the line. So Jonathan, if you would address this question, I know you made a response in the chat, but the question is, until we have Sandy Hook Promise programs, for those of you that are on the line, we are beginning to implement the Say Something anonymous reporting system. It's an anonymous reporting tip, live tip function for our secondary schools. So the question is, until that is in place, how are we talking to children about where and to whom to say something if they know something? We have the Bully Patrol line, but so Jonathan, how are we communicating to kids about how to speak up when they see or know something? Okay, Jonathan is on the line. Multitasking. So I know Jonathan put the Bully Tip Patrol in there, so I'll hold that question and come back to it. I'll go to another question. This question is there a parent support group that meets, or where could a parent perhaps find that parent support group? To anyone on the panel that might be aware of that.
Brittany Todd, thanks. There are a bunch on Facebook that you can link to. So sometimes, depending on what topic you're wanting and what county you're in, if you search on Facebook, there will be some resources that can come up there. There are a lot of counselor groups and stuff on Facebook too that you can usually send questions to that would be able to point you in the right direction. Most of those are outside resources from Forsyth County and our school systems. Also, the PTA at your school is a really great resource too. At times, they can help match you with some other groups that work outside of the school as well, and even get together on their own, depending on what it is that you are looking for in terms of support.
And I will also just mention, as far as parents support groups, again, depending on what the support is around, certainly going on to the Mental Health Association of Forsyth County, they often have a number of different support groups, and if they don't have something, they can certainly direct you to where some of those resources are. Okay. Let's see, other messages. I think that was there's some resources that was placed in the chat. That is off of the information you gave me, Dr. Nicolati said place those links in the chat as well. And I see that Brittany has also placed information on the mobile crisis services, National Suicide Hotline. Information is also there as well. So I'm going to try to respond as best as I can to the question about what we're doing around helping kids. That we have made a concerted effort to just communicate and push out that the fact that the Bully Patrol tip line is out there. It is placed on a district website. It is also on every single school's website. So students have that information and can certainly report anonymously. But we also encourage kids, just in general, if they're seeing something or aware of something that happens in school, to just go to a trusted adult. And I know we've had situations where we found out about things because kids reported that. And I would say, as a parent, long out of the parent game, she's an adult now, but, we've talked a lot about having those conversations with our kids. And one of the things, again, is keeping that door open for the conversations and letting them know who are those safe people that can go to talk to. But as a district, we've put that information out there and continue to make sure that our kids know that they can report things anonymously. There was someone from the audience says that local support groups can be found on Psychology Today website. You can search by topic and your location. That's great. I didn't know that, so that's a surface resource. Someone had a question regarding social emotional learning, and I think our school folks, so that might be you and me, Ms. Long Williams. The question is, apart from the tragic event or the traumatic event that has happened, what's actually being done around social emotional learning? And are we using it within the context of also looking at cultural and environmental factors?
So I think we have someone that's over social emotional learning for the district, and I think each school has taken on certain things that they're trying to do with their students based on grade level, because it's going to vary, from elementary to middle to high school. And I think the school counselors, I know in elementary school, they probably do a lot more one-on-one type stuff with the kids. But if there is a specific concern about some additional social emotional things that you have, you probably would want to contact each school directly, because I said, the resources may vary from school to school, but those resources are available for all students.
Yeah, so we have, as a district, have been working on social emotional learning for some time now, and this year we hired a director of social emotional learning and restorative practices, and part of her work is getting this started again, sort of a restart. We have SEL, we call it SEL coordinators in all our schools. The district has hired social emotional learning coaches, so they will be working with the director of social emotional learning as well. So really significantly looking at that piece just in general. Our elementary curriculum has SEL lessons that are embedded in that, so our elementary schools get that. Our kids who are at the secondary level, and I believe it's through 9th to 10th grade, part of the state curriculum for health and PE incorporate information about SEL and mental health. So they're getting it in different ways, but our focus as a district is making sure that we do have, and we've had to develop one for the state, a social emotional learning and mental health improvement plan. And it includes very specific action steps about what we're going to do, how we're going to do it, and how we're going to assess. So as a district, we have a lot of things in place. And then the role of the director, as she's now on, is to coordinate those things, make sure that there's adequate training and technical support around those issues. I see another question that's jumped in there. Okay, so Dr. Veach has added some resources here in the chat. Baymark, which is one of our providers here, she's added their numbers. There's Insight Services. These are all for substance use. And of course, we have Navant Behavioral Health, Wake Forest Psychiatric Addiction Specialists, and Cardinal Innovations, which, by the way, Cardinal will partners as of, I think it's tomorrow, the 15th, I'm not sure, will actually be the LME, the local management entity, into which Forsyth County falls. So that will be a change for us, but those numbers are there for you to access as well. And I think that's all the questions, unless I missed any. And of course, Be Balanced Counseling does have someone who's also licensed as a clinical addiction specialist. And I will say also that some of our social workers are, and Ms. Long Williams is one. And I know we've mentioned our counselors and social workers. I would not be a good psychology director if I didn't mention that, our schools also have school psychologists, and our student services staff is committed to working with our students. That's just what we do, right? To work with our students and help them as needed, as well as our families as well.
And some of our counselors are either currently working on or have their licenses as well in addiction. So
in addition, right? Absolutely. Those are all the questions that I see. I want to thank the panelists and you, Dr. Nicolati, for moderating. In particular, any of our community partners that are on here now or have been on, just thanking you for reaching out to us. One of the things I love about Winston-Salem Forsyth county schools and our community is that it's a community that really cares and it's always willing to reach out and to help provide support for the district. So I'm really appreciative of that, and that is how this forum came together. So thank you all for joining us, and again, my heartfelt appreciation and thanks for just being here to answer these questions, to continue to support us as a school. You all live in this community and this neighborhood, and your kids come to school here, or they may have been in school here, and we know how important it is to let our students and our families know that this support is here and available for them. So thank you all once again, and that would conclude our forum for today. Thank you to those of you that listened in on Facebook or the district, or was just here with us as well. Thank you.
Thank you for joining us on your school channel, Cable 2.